Coming up on Why Should I Trust You? President Trump has just signed a brand new executive order, effectively upending the existing recommended schedule for vaccinating America's children. It reduces the number of universally recommended vaccines, calling for the breakup of the MMR vaccine into 3 distinct shots, and calls for vaccines to be spaced out across separate appointments. It also instructs the Department of Justice, among other agencies, to look closely at whether parents' rights are being protected in states which do not offer religious exemptions for children to attend public school without being fully vaccinated. The president at the Oval Office signing referenced possible links between vaccines and autism and said, quote, large amounts like vats of vaccine are currently pumped into your child's body. That statement, as well as the link between vaccines and autism, have been widely debunked by many inside science and public health. So what are we to make of all of this? What exactly happened this week with this executive order? Does it actually change anything? And even if it doesn't the very act of announcing it change things as far as trust in the vaccine schedule or what parents think that they should be doing when they go to the doctor? What are supporters of Kennedy and the president and those who have wanted to see more flexibility in the schedule thinking? What do public health and frontline doctors think? Well, today we get to ask them directly. We're going to speak with Dr. Deb Houry, the former CDC chief medical officer who resigned in protest last year, as well as emergency physician Dr. Craig Spencer, pediatrician Dr. Joel Gator Warsh, and MAHA mom and supporter Nancy Fuller to help us process the executive order. We have a lot to cover, so let's get started. Hey, welcome everyone. It is so good to be here with you today. We had a whole episode planned, but we kind of threw that all out the window when the executive order came out, and we decided that that was really worth digging into today. Kind of like our old days, Tom, in the newsroom. As we said, we are all about this executive order today that President Trump signed. He signed it on Monday, and this would effectively, like we said, revamp or kind of upend the childhood vaccine schedule. Of course, there's lots of things that would happen before any of this could happen, and we don't even know if it could actually take place. That's kind of the point of this episode today, to talk about that and a few other things. And the reactions are, of course, pouring in from all quarters. But first, who are we? I'm Brenda Adhikari.
I'm Tom Johnson.
I'm Maggie Bartlett.
Yeah, Dr. Mark is seeing patients. He'll be back with us next time. And you are listening to Why Should I Trust You, a weekly podcast exploring the breakdown in trust around mainstream science, medicine, public health, and AI. And through weekly conversations featuring diverse perspectives, we try and figure out what, if anything, we can do about it.
And we want to take a minute to point out that on this show, we're most interested in how and why people think the way they do at a time when we're very divided and polarized. In our interview portion, you'll sometimes hear things that are said that even we acknowledge aren't always supported by established facts. We do our best to point that out where we see necessary, but most importantly, we believe the conversations are valuable in and of themselves, kind of the way they flow out as a way to learn and deepen understanding. And as always, you can email us at questions@whyshoulditrustyou.net. Please take a minute, subscribe, follow the podcast, leave us a rating, a review, a like if you like us. Okay, so Tom, before we bring in our guests, help us understand what happened with this executive order this week.
Yeah, so the executive order, or EO, when you read it, it makes it clear right out of the gate that this is about pushing forward with the president's goal of aligning America's childhood vaccine schedule with that of Western nations. And you recall that the president instructed HHS and Secretary Kennedy to study the vaccine schedules of other developed nations and bring America's in line with those. And the idea being that America has more vaccines on its list than other nations. So HHS did that last winter, and it modeled a new schedule after Denmark's, among other nations. We did a whole episode with Public Health Voices from Denmark. And of course, it's a tiny nation with universal health care, which is very, very different from the US. But anyway, that revamping back in January did not include the work of ACIP, which of course is the Committee of Outside Vaccine Experts, whose job it is to study the data and recommend any changes to the nation's vaccine schedule. So back in January, this new schedule was pushed out. It reduced the number of vaccines that would be recommended for all kids from 17 down to 11 and moved the rest into some new categories. There were now vaccines that were only recommended for high-risk groups. There were others that were moved to this shared clinical decision-making designation. So they were no longer automatically recommended for every kid, but rather it would be an individualized decision made with your doctor. ACIP, as we said, was not involved in reviewing the data and revamping the schedule. So that took the whole thing to court. We had several medical groups led by the American Academy of Pediatrics. They had already filed a lawsuit against HHS. They added this onto it, and a federal judge made a preliminary ruling, which effectively froze the change to the schedule and froze the work of ACIP, all because, among many things, ACIP was not involved in this change. So that brings us to this week. President Trump's brand new order reaffirms that goal of getting us in line with our peer nations. And it really does appear to be a workaround of that judge who froze the last revamping.
Yeah, and I think one of the main questions is like, what does this EO actually do? The big headline is that it moves a handful of vaccines from routinely being recommended to all children to these different categories. And so like, let's look at those different categories. There's the first one, which is immunizations that are recommended for all children. So that's like our measles, mumps, and rubella, combined MMR, diphtheria, tetanus, pertussis, polio, hemophilia B, pneumococcal disease, HPV, and varicella or chickenpox. There's the secondary group, which is immunizations that are recommended, like Tom said, for those high-risk groups or populations. Those would be like our RSV, monoclonal antibodies, hepatitis A and B, meningococcal B, as well as strains A, C, W, and Y, and then dengue. And finally, this like third category where immunizations are being based on shared clinical decision making, which some have pointed out that that's been going on for a long time. And so this reframing really pushes towards that category. And that's hepatitis A and B, rotavirus, meningococcal disease, influenza, and SARS-CoV-2. And yes, hepatitis A and B are listed in both the second and third category. And I just think it's really important for us to note and underscore that hepatitis A, hepatitis B, rotavirus, and influenza were previously part of the routinely recommended for all children, and now they're in this different category of shared clinical decision making.
So then the order really zeroes in on the MMR vaccine. And in the US, since back in the early 70s, these three diseases and the vaccines for them have been clumped into one combined shot. Now this new executive order states that the MMR vaccine should be broken up into three separate single disease shots. So right now, the US doesn't produce three individual shots, only that one combined shot. The order states that Secretary Kennedy will report back in 90 days with a plan on how to source these single disease shots. And just for everybody listening, it clearly states that the combined shot will remain available until these new single shots are ready. In another line, the order states that, quote, to the maximum extent feasible, all childhood immunizations should be administered at separate medical visits. And it also orders HHS to assess the ideal timing and sequencing of all core childhood vaccines. And that's a line that I think caught a lot of people's attention and isn't spelled out with any more specificity. So the new executive order then moves to, let's call it, parental rights. And it instructs the Department of Justice and the Department of Education and HHS to explore what levers they have to challenge states which do not offer non-medical exemptions to school vaccine requirements. So just to back out, we know that all 50 states and DC require certain vaccines for kids to attend public school. All states allow exemptions for medical reasons. 47 states allow exemptions for religious and/or personal belief exemptions. So this leaves California, Connecticut, Maine, and New York that only allow medical exemptions, no religious exemptions. So beyond that, the order tells states to review all of this new recommendation through this EO and consider updating their rules and requirements for what vaccines kids must have before attending school. But to be clear, it does not require the states to do that. And a lot of people online are running with this, saying this is a huge victory for parental rights. But again, the fine print doesn't seem to match that. So, in terms of context, at yesterday's Oval Office signing ceremony, President Trump discussed his worry that the number of vaccines American kids receive may be connected to the rise in autism rates. And this is despite a large body of peer-reviewed research, including studies involving more than 1 million children, that has found no association between childhood vaccination and autism. And finally, it's important to note that the order is not expected to impact insurance coverage of any of these vaccines.
Okay, thank you guys so much for that great background. In a moment, we're going to be joined by doctors Deb Houry, Craig Spencer, Joel Gator Warsh, and MAHA mom Nancy Fuller. Okay, welcome everyone. So we're joined by this terrific crew. I'm going to intro everyone here for a sec. So first, we're joined by Debra Houry. Dr. Houry served as Chief Medical Officer and Deputy Director for Program and Science at the CDC and as Acting Principal Deputy Director, making her one of the agency's most senior leaders at that time. She resigned last year over what she described as political and ideological interference at the agency. She now advises health departments and health companies and is a senior fellow at the Yale School of Public Health. Hi, Deb.
Thanks for having me.
Next up, we have Dr. Joel Gator Warsh. Dr. Warsh is an integrative pediatrician and founder of Integrative Pediatrics, where he takes a more holistic approach to children's health. He is an author, and his Substack is Between a Shot and a Hard Place. And when it comes to parents making vaccine decisions, Joel is a passionate advocate for informed consent. Welcome to the show, Joel.
Thanks for having me here.
And we're joined by someone who's no stranger to the show, Dr. Craig Spencer. Craig is a regular. He is an emergency medicine physician and associate professor of the practice of health services, policy and practice at the Brown University School of Public Health. He writes for The Atlantic and the New York Times. In fact, he just recently had an article for The Atlantic published called Public Health Needs MAHA. Welcome to the show, Craig.
It is wonderful to see you all yet again.
And finally, another good friend of the show, Nancy Fuller. Nancy is a mother of an adult son living with autism and epilepsy. She lives in Ohio and volunteered for the Kennedy campaign in 2024 and considers herself a MAHA mom. Welcome to the show, Nance. Welcome back.
So glad to be back.
Okay, so first, we want to just kind of put this to everyone, and we'll start with you, Deb. What was your immediate reaction to the executive order? Like, did you think there was a scientific basis for these changes?
It's tricky because I'm one of those like kind of grounded, practical people. And so like for me, like even things just like separating out MMR into 3 components, like you can't just make that happen. And so like when I see an executive order, it's something I want to be able to implement. And so like I kind of scratched my head. I was like, okay, there's a bunch of things here that you can't make happen. You can certainly study them, but that will take many years. And like the executive order said 90 days for many things. And so I was like, how can you be successful in any way, around that? So that gave me pause. And then, I think the other thing that gave me some concern too is just when, they separate out some of the different vaccines. You can look at many studies different ways. And I felt like that's where some of these were coming from around different tiers of vaccines. I think for me, it was about, will people still have choice to get the vaccines if they want them? Or is there a chance that access might go away or insurance coverage over time might go away? With hepatitis B, we've seen that there's, people that get missed during screening and things like that. And so I worry that if it's focused on things only like high risk, we're actually going to miss people that are high risk by not asking questions or people that don't have access. So I worry about a lot of the unintended consequences. And then I guess the only other thing is, as a doc, I was concerned that the 3 people standing there talking about it weren't practicing physicians. I'm not a vaccine scientist. So if you ask me about all the details within vaccines, I'm going to turn to Joel or somebody else that's going to know it better. So I would hope that the 3 people that are standing behind it would be able to speak more to the science than they could.
Yeah. So, speaking of Joel, I want to bring you into this conversation. You're a pediatrician and you're somebody who really lobbies for informed consent. And, you've written things that I think many in the MAHA community would probably, it would resonate with them. But I did find, you wrote the Substack about the executive order and you said it left you scratching your head a little bit too. What was your reaction to it?
I was honestly very surprised. I mean, first of all, it seems like we had a lot of movement at first around vaccines and informed consent and changing the policy. And that has changed, I think, a lot over the last few months, where it seemed like it was kind of moving away from that. And then all of a sudden, after a bunch of lawsuits and ACIP kind of being shut down and shackled in the courts, then we have this now executive order, which seems to go back the other direction. And it's very similar to what Secretary Kennedy came out and said with the HHS just a few months ago, and that was put on pause. There were a lot of legal battles against that, and we still don't even know where that's going to go. So ultimately now we're just repeating that again. And I'm assuming that once again, you're going to see organizations push back, going to try to fight it. And it doesn't really resolve the underlying issues, which are creating infrastructure, discussing the science, and bringing in all the stakeholders. It doesn't matter if you make an executive order if none of the doctors know what to do with that or even agree with it. They're just going to push back. And I really want to see everybody sit down at the table and have discussions, pro-vaccine, anti-vaccine, people in the middle, and discuss where their differences are and hopefully move forward to bringing that science forward. Even if you disagree, even if you think that some of the things that are saying are correct, I just don't see how that gets us there. And I would really love to see that infrastructure put in place for the long term instead of just this fighting back and forth, which seems to be all that we're seeing these days. And then ultimately the parents pay the price because they're left scratching their heads saying, what do I do? And just like Dr. Houry said, like, well, what do you do with that MMR decision? Like now parents are saying, okay, well, is it unsafe? Well, should I just get the measles on its own? But that doesn't even exist. So then you're basically creating discussion around something that's not even possible at the moment. And while I'm happy to have them look into it, where I think they even should have a single measles vaccine as an option, I think that's reasonable as something we could have in the future. But we need to have that infrastructure put in place to actually make that a reality for parents.
Nancy, as we kind of get everyone's first initial reactions here, I just want to ask you, because I think you come at this obviously from a very different perspective as a mom. And a mom who supported Kennedy and has really advocated for the search for answers, right? When you saw this news yesterday of this executive order, how did you process it? Did you see sort of an intention here, a motivation here? Was that something that you reacted well to, or did you have some other reaction to this?
Tom, had mixed reaction to this completely. On the one hand, as a mom who, and I do speak for myself and for moms who have children on the spectrum that require 24/7 care. I think you have to qualify that because there's a lot of people that feel fine about everything and vaccines and everything. So I'm a mom that has 24/7 care over the last 33 years. And that gives me a different vantage point because I think many of moms and parents in my position never got answers, Tom, that we had talked about previously, never got answers on how could this happen. And in our case, which is, I think, 30% of the autistic population, we had regression. So we had normal development that looked like everything was fine until it wasn't. And at 2 years plus, we completely lost the essence of who we saw our son to be. So with that vantage point, and then fast forward 30 years of looking for answers on my own and never hearing from the government, from public health, from my physicians as to what could have been the underlying cause of this. So then what happens is your brain goes to, well, what happened in those 2 first years of life that we should be thinking about? And I hate to say it, but when you look at my son's first 2 years of life, there weren't a lot of significant things going on other than vaccines and the quantity that was going up in the requirements. He was fully vaccinated. I was on board for all of that. But when that's kind of the elephant in the living room and you don't hear anything for 30 years, and then a Kennedy comes along and says, I hear you parents. I think we need to have change. I think we need to explore and do more studies to get to the safety so everybody feels comfortable going forward. That resonated with me and a lot of people. So when this came down yesterday, I was really sad. And I was very sad because I feel like strong arming the situation without good new science on safety as to why we should be making these changes, strong arming it isn't going to win. It's not going to win in my book. It's not going to win in physicians' book, our government agencies. It's not going to be a winning strategy. And I felt sad because it left me thinking we're only left to litigate. We're going to throw this out there and we're just going to sue everybody to get, is that how we're going to communicate going forward as a country? Just to work under the litigation. So I don't think we had answers yesterday, even though I resonate underneath all of the intentions with why they think questions need to be asked and why I have questions that are unanswered. I resonate with that. I don't resonate with how it was handled.
I just want to follow up before we bring in Craig, Nancy, and we've talked about this in the past. You know and are aware that there's been large peer-reviewed research over decades that has investigated whether there's an association between childhood vaccination and autism. And they have not found a link. You're sitting there yesterday, you're seeing this revamping, this upending of the childhood vaccine schedule. Some of the rhetoric around why that change is being made in the Oval Office was a suspicion, a linkage, the possibility that all these vaccines, the number of vaccines we get, is linked to autism on the rise. Was that a moment for you to say, yes, damn it, I've been feeling this for a long time, and finally someone's saying there's a link, or at least implying there's a link? Or are you more cautious?
I'm not certain that all the studies that have been done to date have reconciled in my mind that there is not a link. So I'm not reconciled on that. So when I hear them surface that more needs to be done to address it, I do say, yes, I believe that. But to draw conclusions on their own, which is what it appears to me to be happening, is premature, and it's just not well done. So I feel both ways strongly, Tom. I feel strongly that more needs to be done, and I don't necessarily trust all the science, and I do have my own suspicion from various things I've read about funding of so many studies that concerns me and who's behind the studies. Therefore, it creates a lot of more suspicion in my mind that I can trust everything that's been done in the past.
Craig, you are someone who has worked very hard to make relationships with supporters of the MAHA movement, finding common ground. Yesterday, you're watching a press conference in the Oval Office with the leaders of the MAHA movement standing next to the president, announcing this massive change to the vaccine schedule. We can talk about, in reality, has it changed things, but it's a huge messaging moment. What was going through your mind?
The first thing I thought was, quite honestly, I wonder what Nancy is thinking about this. And so thank you for sharing. And also just thank you for your friendship and for being so honest and vulnerable and sharing your story, because I honestly think with the few minutes that you shared at the top of this, your initial comments are something that I think all of my colleagues in public health should listen to understand what this moment is and how it appeals to parents like yourself that feel like they don't have the answers they want, and how we can do a better job of helping you feel like that research gets to you, those answers get to you. My initial thought was, one, I feel like we've seen this before, and in a sense we have, right? We've seen similar announcements, including, a lot that has been litigated, as Jewel has mentioned, in the case of AAP versus HHS, that is currently under appeal. A lot of the moves and decisions there were found to be likely illegal. And I suspect that those will stand up, just as the executive order will likely be undermined by the fact that just a lot of this just can't work through executive order, nor should it, as we've already said, as Nancy said. I sat there and I watched a press conference, at the same time that everyone is pulling Fauci under the bus, accusing him of every crime, and we're angry about, the trajectory of public health and how political it's being. But then we see an announcement that was pure politics and not public health. As Deb pointed out, there was not a practicing physician in that room. There was no new science given. And if you look at the talking points that were covered, RFK Jr., Trump, and the White House memo all gave a different number for how many vaccines kids get before whatever birthday. And and none of them even jived, and none of them reflect the actual reality. And so itself was internally inconsistent. But I think more importantly, to Deb's point, so much of this is just operationally not going to work. It's not an executive order that determines vaccines, nor should we want it to be an executive order that determines vaccines. I think we can all agree, Joel, Craig, Nancy, Deb, all of us, that we do not want an executive order being the thing that determines the vaccine schedule. It's the CDC, it's the ACIP. This is an opportunity. We have a new CDC director finally for the first time and for ever. For the majority of this administration, we have not had anyone permanent in that role, which I think is a massive loss and a shame. And then just similar to the splitting up an MMR vaccine, putting that into individual shots, it's not just a lot of money, it's a lot of time, it's a lot more resources for nothing to show that it's going to have a benefit. And then just kind of lastly, the thing that I was thinking of, I can't understand how internally inconsistent this is and why it's appealing, because if the big problem is that kids are getting 72 or 84 or 95 vaccines, what is meant to be appealing about saying, okay, good news is we're not going to do those all in one visit. We're actually going to make you come back 5 times to get 5 times as many shots. Does that mean that you then get 400 of them? So I think it's really, really confusing. It adds to the chaos for parents and caregivers. And I saw no new scientific evidence that was provided. I am here, just like Joel, I think you wrote in your piece, Deb, I know from your own practice, and Nancy, from what you've said, all of us want the most updated, perfect, best guidance that we can give everyone on all sides. And do I think that there are things in our current guidelines that could be improved or where science could be bolstered? Absolutely. But what I saw yesterday does nothing to do that and does nothing to increase my confidence. And it sounds like probably not the confidence of the majority of Americans who are concerned about other things.
Thanks, Craig. Deb, you wanted to jump in with something.
Yeah, a couple of thoughts, and one just kind of going off what Craig said. Not only that, when you separate out MMR, which you can't do right now, but if you did, with a live attenuated virus vaccine, you can get a febrile seizure. So now instead of one time of getting it, there's 3 different times you could get it. And if you're talking about worrying about some of the adjuvants and vaccines, not just one vaccine, like Craig said, now it's going to be over 3 times. So that concerned me that we're actually not thinking about the unintended consequences of this change. It might be in theory interesting, but aren't we thinking about? And that's why you need science ahead of time to think about what are all the risks and benefits. And then, Nancy, thank you for sharing, the story about your son and autism. And I think autism is a significant issue in this country. And I worry that if we focus on a single question versus 15 questions, and being willing to look at everything, we're going to miss something and we might miss interactions. And that's what concerned me when I was at CDC, when we were asked to look at autism. I said, great, here's a big study. And then I was told, no, look only at the vaccine safety data. And I said I want to look at everything. And I think it does a disservice if we're not willing to consider everything. And then I wasn't even thinking about this till y'all mentioned it, with a CDC director around the corner. I don't understand the timing of the executive order. If you've said that this is the most qualified CDC director ever, give her a chance. Let her start. Let her get an ACIP in place. Let her look at the evidence. But when you do something like this, it puts her at a disadvantage because a decision has already been made, and now she has to respond to it. Maybe this is the path she would have gone, but this doesn't allow her to make that independent decision.
What I'm hearing all of you say here is that this executive order didn't really hit the mark for any of you, and that it left you with more questions than answers. Certainly there's now everyone is that there will surely be legal challenges. There's process questions. We don't even have the ability to separate these. So there's all that, and it seems like that there's some consensus here on that. I'd love to take us to a place of whether or not these questions even deserve to be asked and what those questions even are. And here's what I mean when I say that. I think one thing that we've acknowledged on the show is that there is an increasing number of Americans in this country who do have questions about vaccines. You know, there's the poll from KFF that showed that 1 out of 6 young parents skip or delay vaccines. There's something like up to 20%, and in some cases higher, of Americans who say that they have little to no confidence in either the schedule or in the safety of vaccines. Those aren't small numbers. Of course, on the corollary, you know, you all have also mentioned that there's upwards of 80 to 90% of Americans who do have confidence in taking vaccines and sort of general questions about the vaccines. But as we stated on the show, there are these very kind of specific questions. And then when you put COVID vaccine into it, the numbers get much higher on the reservations and the hesitation front. I guess my question, sometimes it can seem like the narrative inside public health is we can't even ask some of those questions because there's a fear that if you allow parents who want some flexibility or the idea of maybe spacing out vaccines or, you know, really questioning whether you need to take the Hep B shot like right at the first few hours of birth, that you're sort of immediately put into a category of being an anti-vaxxer. And Deb, I want to actually start with you on this and then go to Joel. Do you think there actually is a conversation worth having? We understand that the president maybe is not taking the right approach, but is there actually a conversation that's worth having that somebody needs to have to address these fears that many in the country have?
Yeah, absolutely. And I'd say that's something that, you know, I'd love to hear Joel's thought that really it's between the pediatrician and a parent, because you know, each family is going to have different risk factors, different, you know, medical histories, different concerns. With Hep B, you know, I think it should be, you know, given at birth. But if you're not high risk, you've got good follow up, you're not going to daycare immediately, you could probably delay it. But that's a good conversation to be having. If it's somebody that doesn't have good access to healthcare, might get lost to the system, I would worry about not being able to have those conversations and that person not having access to vaccinations. But I think it's absolutely fine to ask questions. You should want to, with any medical procedure, ask about the risks and the benefits. Is this the right time for me? What happens if I delay it? What if I, you know, have a kid who's not going to go to daycare for a couple of years? You know, can I wait? Those are all, I think, appropriate questions that you could ask. If you're in a big family, you know, if you travel a lot, that might introduce some different, you know, nuances to it. If, you know, I was an ER doc, you know, so I was coming home with a lot of exposures. I absolutely wanted my daughter, you know, vaccinated, and then would think about many of the exposures I had when I was at home. But it's fine to ask those questions. You should ask them about cancer screening. You should ask them about environmental exposures, PFAS in water. These are all questions we should be having about our health.
It sounds though, Joel and Deb, I don't want to put words in your mouth, that maybe for Deb, it's a conversation to have with your physician, with your personal physician. But when it comes to national conversations, or maybe even something that is like originates with government in some ways, that there does need to be a policy of these vaccine recommendations. And I'd love to bring you in, Joel, that do you sort of feel like it's really up to the doctor and the patient how this goes?
I think that's one part of it, but I think that's one of the big issues that medicine and public health in general are missing is, yes, I agree that doctors need to be a little bit more willing to have these conversations and a little bit more open-minded, because as you mentioned, that hesitancy is increasing. It's not going anywhere. And especially with COVID, it threw gasoline on a fire, and now we have all of this back and forth. But I don't think it's just about the doctor and the patient, because those are conversations specific to that patient, but there are a lot of questions that are much bigger than that, and that require more research and more discussion, and going back to the drawing board and really looking through where we are with our public health recommendations and making new or different or adjusted recommendations as we move forward. And I think a lot of physicians and public health officials are really digging their heels in and pushing back, and they have this thought that if we give anything, if we are willing to have discussions, that's going to lead to people being more anti-vax and going to lead to more people not getting vaccines. And if there's any nuance in the conversation, that just leads to people not getting vaccines. And I think that you can see that people are able to handle some nuance. And I think we need to be honest. And that lack of honesty in COVID really hurt us. with public health, with not having some nuance around if you've had the disease before, if you had some sort of infection, then maybe you don't necessarily need a vaccine. Saying things like safe and effective over and over again as a slogan really hurt our credibility, because you can't really say something's safe when it's new. You could say, based on what we know, it seems that the benefits outweigh the risks. It seems like we haven't seen any major safety signals, but we really don't know what the safety is 5 or 10 years down the road. And it didn't seem like we got a lot of that nuance. And that's continued moving forward. So to answer your question specifically, I do think we need discussion that's bigger than just the pediatrician and the family. I think that's where the families need to go. But if we want the doctors to have new and different information, we're going to need bigger conversations around where we go with the research, what research we get. And just like Nancy said, to finish up, I think there are many parents that are very concerned about things like autism and vaccines. And while doctors continue to say there's no connection, parents are getting more and more concerned, and families see the chronic disease epidemic. Doctors who have worked in hospitals see some of these diseases, and they see the kid in the ICU who had RSV, and they're worried about that. Whereas parents are much more worried about autism, allergies, autoimmune conditions, and all of these things skyrocketing. And the two sides don't seem to be connecting on where their fears and concerns are. And so the conversations are not coming together. It seems like everyone's talking over each other. So yeah, I do think we need those conversations.
Jill, I just want to stick with you for 1 second, because we've spent a lot of time on the podcast talking to supporters of the MAHA movement. And one of the real themes that, obviously emerged through the pandemic and out of the pandemic was we heard a lot of declarations from people almost in a dictatorial or authoritative way. And a lot of those recommendations or mandates were not based on science. They were just declared. And then we had to live with the consequences. Do you feel that there's a lot of difference between that criticism and what happened yesterday in the Oval Office of new guidelines being pushed forward without undergirding scientific evidence motivating them? Isn't that just another dictatorial, authoritative declaration rather than a deliberative process of reviewing science, bringing in experts to crunch the numbers, and voting on a recommendation?
Honestly, as someone who's been involved in this for a while, yeah, I think so. I mean, I think that, being a part of the MAHA movement and to some degree, it's concerning to me. I mean, I said that specifically many times. I think some of the things that are happening right now are just kind of the opposite end of the spectrum. And many of the reasons why Secretary Kennedy is there in the first place is because of people's concerns around mandates and the concerns the way that things were accomplished throughout the pandemic. And so you had the pendulum swing the other way. And now it seems like we're swinging back the other way where, it's not quite the same. I mean, these are not necessarily mandates, but they're discussion points, they're executive orders that are stating what should be done without bringing everybody to the table, bringing the people that disagree with you to the table and having those discussions. It's okay to disagree, but if you're mandating something that you believe, then it's just the opposite end. If you're mandating something different that the other side believes, and that's not the way that I think things need to work. I think we need to sit around the table, and public health's job, in my mind, is to make recommendations. The doctor's job is to make recommendations and educate. I mean, it's really in the name. Doctor means docere, right? It's to teach. And ultimately, it's not to force. And the schedule is the CDC recommended schedule. It's not the CDC demanded schedule. And there are situations like Dr. Houry say where maybe there are situations where it's not the right thing for that patient. That's where the doctor-patient relationship comes in. But if you ultimately just go the other end and start demanding no vaccines or fewer vaccines based on random recommendations from just a few people, that doesn't make any sense either. You want the doctors involved, you want the epidemiologists involved, you want the infectious disease doctors involved, you want the anti-vaxxers involved, you want the pro-vaxxers involved, you want the scientists involved. Everybody needs to come to the table and find some middle ground here. And that's the last thing that's happening. It's just the other end of the spectrum right now, I think.
Nancy, you wanted to jump in.
Yeah, I just wanted to add to what Joel was saying that this could have all been conveyed very differently. Meaning, if the administration wanted to say they've got concerns with the current schedule, they've got concerns, I love some of the elements, of needing risk-benefit profile on people. There have been at least provided concerns by the Americans that are these the safest vaccines we could have. Articulating that there are concerns that you're acknowledging And then because of those concerns, we're investing this much money in this commission to draw these type of, as objective studies or comparisons that we can do to deliver something that everyone can really feel comfortable with. It could have, in my mind, been a win, because then they would have heard voices of people like me and said, yeah, I've had 30 years of these concerns and you hear me and you're going to invest. But I was disappointed to hear when Kennedy, I believe, asked the NIH for funding, a lot of funding toward these type of things. It was declined a few months ago. And I know last October they got $50 million and Kennedy wanted $5 billion. So I don't know what these numbers mean in terms of what you need to deliver. And I don't know if $50 million is going to, quite frankly, deliver anything of value, because I don't understand what's at stake to get that right kind of thing done.
I mean, Nancy, I think it's such a good point that, you talk about Kennedy not getting it. I mean, now it's like an entire public health and scientific infrastructure that is, at the same, like, I think the irony of having something called Make America Healthy Again at a time when the scientific infrastructure, in order to be able to actually provide some of those things, it has been just decimated. It's, I think for people, like, we're now just stuck in a place. I think we're now, and I'm saying this as someone who's really surfaced the concerns of so many people, that, Nancy, from MAHA. There's just now the mistrust is coming from all sides, right? It's not just folks who were mistrusting public health during the pandemic. Now it's public health mistrusting government, and public health is government. It's like this really bizarre kind of like Rubik's Cube that we're all in. Craig, I wanted to bring you in, and then Deb.
So I think what you're talking about is the fact that public health has seemingly become fully subservient to politics, and that includes the pendular swings that we expect out of politics is now happening in public health, where we feel like once we're in power, we have to do everything we can to not only advance our interests, but to destroy the other side. And to Joel's point of there needing to be some space where we can ask reasonable questions without the same reliance on kind of old orthodoxies. It's remarkably important, and also I think remarkably important for why the voices like Nancy's are so critical. If you think about some of the questions that have been brought up, including on the show, it wasn't that long ago that you had Danny DeLuca on, and he was talking about how he got all these vaccines, and he got the typhoid vaccine, and he didn't just get the COVID vaccine for a whole host of reasons. But the reality is that many people in the public health community would then kind of label him an anti-vaxxer. And I also think about Nancy's experience, where Nancy, I believe you shared this on the show previously, but even after your experience with one child and your concerns maybe around vaccines and how they contributed, you did continue to vaccinate your next child, although it was a slightly different schedule. Is that correct?
It is correct.
And so to your point, like your invocation here, Joel, of, hey, maybe we can do something a little bit different, and this can kind of widen the tent, or the ability for folks outside of public health to have greater trust in public health. If only we were able to think about some novel ways to do this. That doesn't mean we're ceding the field. That doesn't mean that we're going full into, every anti-vax propaganda. If we just like ask a question that makes us, seem like we're open to the concerns that the public itself is having. People like Nancy are showing us that they may continue to have concerns, they want answers, but they're also willing to be flexible. They want to engage in respectful dialogue. I keep saying this, but we can't have public health without 40% of the public. And there's a big chunk of the population that is telling us it's not just vaccines that they're concerned about. They're concerned about so many other things. They have legitimate good faith questions that we need to engage on. Otherwise, what I see the trajectory being is that when we, whatever we is, get back into power, the impetus is going to be just to flip the switch, put all the things back into place the way they were in 2019 or 2024, whenever the halcyon years of public health were, and kind of trample over all of these concerns that have bubbled up from people that are mostly in that movable middle. If you look at KFF polling, the number of people that believe, all of the most common vaccine myths is relatively small, right? Less than 10%. It's the majority of folks that are somewhere in the middle that have good faith questions that they need answers to and don't feel like that information or science has trickled down to them. It's our job in public health to not just say, we have the data. If you don't understand it, it's your problem. It's our job to make sure we translate that in a way that people can understand it and feel like their questions are being answered. The problem is that what we saw yesterday didn't do any of that. It just cemented more of the politicization of public health, not towards getting us more answers, but to making this more of a divisive issue.
Deb, you wanted to jump in.
Well, now I want to agree with what everybody has said. What I would start with is Joel, you talked about swinging the other way. I think that's my concern is if we're always in the different extremes, we're never going to make a lot of progress because everybody's going to be reacting back and forth. And, Nancy, I think when we're talking about gold standard science, I believe in gold standard science. I just wish that we said what it meant. And that's that, it's peer reviewed, you're transparent with the data, you can replicate it, and you don't know the answer before you go into it. So if they made the announcement yesterday, we're going to spend all this money to study this, and we don't know what it's going to tell us. That's what science is. You have to be open to where it's going to take you. And then Craig, I liked what you were saying about rebuilding and changing. I actually wrote a piece just a couple of days ago because I'm coming up on my 1-year resignation, and I wanted to do it differently. I built it about hope, and resiliency, and how do you do things differently? It's not about just putting pieces back each time. It's how do you think differently? I think that's what we do in public health now is how do you work more local and state communities? How do you bring in, nonprofits? How do you make sure people lived experience are at the table? But we have to follow science and data as part of it. We have to look at the model differently. And this is the time to do that.
Yeah, I just want to go back to Craig for a moment, because it's a real fine line and a real balance that you're sort of proposing. I can imagine a lot of people are saying the data is not subjective. I'm sorry. It shows one thing. We can all objectively look at that and see the answer. We can't then mold or shade our recommendations of vaccines to sort of make people feel better or more comfortable. The data is the data. We've got to go with what the science is telling us. And if new data comes in and it refutes it, let's reconsider it and change our recommendations. But this is life and death. This is not an area to kind of shape things to make people feel better because they have questions. We have to just go with what we got. I mean, what do you say to that?
I think that's all right. And absolutely, to Deb's point, we need the data. And it sounds like Nancy is saying the exact same thing. We need the data. But there's clearly a disconnect between the data and the people who need it. Also, if you think, particularly in the anti-vax space, I talk about this in the class I teach on the history of public health. If you go back to Jenner's 1796 or 1798 treatise on, vaccination against smallpox, he lays it all out. You have data. And then within just a few years, you have the emergence of an anti-vaccine movement. And if you look at the arguments that are being used online by Children's Health Defense and other, anti-vaxxers, people self-proclaimed anti-vaxxers, the arguments that have been used over the last 200 years have not changed at all. One of the first images against vaccination was kids being thrown into a cow and coming out the other side with horns, which is essentially the same argument as it changed your DNA. The reality is that even if the anti-vaccination language hasn't changed over the last 200 years, neither has the language of public health. It has been data, look at the graph. Essentially, if you can't understand what this graph is clearly showing you, whether it was the smallpox campaigns in the early 1900s in England, or whether it was COVID graphs in New York City a few years ago, if you can't understand what these graphs are clearly showing, then you're the problem, not us. And the reality is that there is a disconnect between the importance of that data, which needs to be objective, needs to be sacrosanct, needs to be, dutifully collected, and how we translate that. Because we're saying that the information, the data that shows no link between vaccines and autism is very clear, study after study after study after study. But then you have someone like Nancy who's telling you, look, this is something that has taken up my whole life, every day of my life, for decades, and I'm still not seeing that. There's clearly a disconnect between that data and getting it to the people that need to see it. That is not necessarily just the responsibility of the Nancys. That's the responsibility of us, me, our field of public health, of being better at translating that in a way that it gets to people like Nancy and her community.
I mean, I think that's really interesting. And Joel, I want to bring it over to you that even in the last 24 hours, I've been watching different reporters talk and do the dutiful fact check of Donald Trump that we keep saying, that the children in Denmark, right? It's like the children of Denmark are like the most cited kind of population when we talk about the vaccines and autism. And look, for somebody like me, who I think is viewing it as a mother who, yes, vaccinated their kids, and I am grateful that, that it was a positive experience for them, for me. I think that there's this impression that somehow that is sort of how the understanding goes for everybody, that like if you just talk about the kids in Denmark, that's just going to mean something to everybody. So Joel, I guess my question would be respond to that. And then I want to just ask you something very directly, which is to both you and Nancy, which is, the one thing we often hear is like, look, doctors can be much more thoughtful in how they approach things. The academy can be much more thoughtful. But there are genuinely bad faith actors out there online who are sowing mis and disinformation. And that, I mean, on our show, we think we put way too much as a society kind of stock into that, and there's much bigger forces at play. But can we not also acknowledge that is absolutely at play?
Yeah, I mean, I'll answer that part first. I mean, there definitely are bad actors. There's no question about it. And that's where the extremes, I think, are the biggest issue with some of this conversation is most people are in the middle, but you have certainly some bad actors, I would say on both sides, but certainly people that are very, very anti-vaccine that say things that don't make a lot of sense, that aren't based on data or evidence. So yes, I think that's something we should understand and try to work on as well. But to what Craig was saying, I think, it's very interesting because the way that he responds, I think, would be the way that most doctors respond. And it was a discussion about the disconnect between doctors and families and getting the information to families that they need to get. And I think that's what a lot of public health is missing is I think a lot of parents, families think there's a disconnect between doctors and what the information actually is. And I think that as somebody who has researched vaccines extensively over, I would say, the last 10 years, and someone who comes from Children's Hospital Los Angeles, super pro-vaccine, I'm not anti-vaccine at all, never would imagine that. We give vaccines in my office all the time. The research, at least to me, is very different than I ever thought that it was. And I think that parents who are in the space, who have read all the books, who have looked into this research pretty extensively, still feel like there's a disconnect between what's coming out of public health and doctors and what the research actually shows, especially around topics like autism. And I think it's not just about reaching the parents with better information or different information based on what we have. I think it's also about parents who have concerns getting that information to doctors and to public health and having the medical establishment understanding what those specific concerns are. And I don't think that most doctors are aware of that. And I can only speak to even just myself because I was not aware of any of the concerns when I came out of residency, and I only became aware as I started getting questions that I didn't have answers to and had to start reading books, and was very surprised at what the information actually does show, where the research has been conducted, how the infrastructure around vaccines exists, the 1986 Vaccine Act, who publishes the research, what research gets taken down, what studies can go through. So I think that there is a disconnect also between what vaccine research we actually do have and what doctors think exists. And I feel like if more parents who had concerns around vaccines felt that doctors even acknowledged their concerns and understood what their concerns were, and were working towards a future where those issues were addressed. And just like Nancy and Dr. Houry said, not conducting studies to find an answer, not anti-vaxxers finding anti-vaccine research and the CDC and pro-vaccine individuals finding every vaccine is perfectly safe and effective. I think if we go into it just being open with questions and finding what we find, that's going to be the research that's going to give people confidence. And ultimately, I think doctors should be totally open to that, because at the end of the day, if there are issues with vaccines, I think doctors would want to know that. They'd want to know why, and they'd want to improve it. And if there aren't, and you get really fantastic studies that parents appreciate and agree that that's the science that they're looking for, that's going to be the research that's going to convince them to get more vaccines and to not be worried. And there is a big disconnect right now between what research exists or what parents feel exists and what they want to see moving forward. And I think if they felt that healthcare was listening to them, then we might have a different future when it comes to vaccines. And ultimately, every parent just wants their kids to be healthy.
Yeah.
So we're all on the same team.
Deb, I want to bring you in because I know we lose you in a couple of minutes because you have to get back to work. But do you think that this is simply an issue of us sort of getting on board with research and explaining it better? Because I just have to be honest, Joel, even hearing that, like, I worry sometimes that because like we're in a like your research, my research sort of world right now. And I am genuinely concerned for people out there who study things like even what you said that you've studied and researched vaccines, but you're a pediatrician, you're not a vaccinologist or an immunologist. You would say that as well. It's very different studying vaccines that way than it is from a clinical perspective as a doctor. And I worry, and Deb, I want to bring you in on some level, like, can anyone work in these conditions, right? That like when you're when epistemically it feels like we're kind of not in the same place of even agreeing what the right research and studies should look like. And then we have to sort of explain that to the public. Like we've never in our lifetimes been in a situation like that. Deb, what do you say to that?
I think it's you'll never have the perfect science, the perfect data. Nothing's ever going to be 100% versus 0%. And in the ER, I would say, this CAT scan says 97% likelihood. I'm going to recommend you do this. I can't promise you don't have this other disease. And so I think that's how we have to approach research is this is the best study we have today. This is what the research says today. I can't promise you it's not X, Y, or Z. And I think it's being willing to have those conversations. On the flip side, it's also hard to say, here's what we found, but here's the 15 limitations. I think once you start saying every single limitation, people then get distracted, even if the data is strong. So you have to find that right balance of being an honest messenger, kind of relaying the risks and benefits. And honestly, as a doc, I would say, here's what I would do, or as a mom, here's what I would do. I think just circling it back to the executive order, unfortunately, I think what we saw was it wasn't science and data, it was ideology that was driving it. And that's a shame because I think it takes any progress we could have a step back and makes things much more complicated to move forward on.
Deb, thank you for that. And I know you have to go. And thank you for joining us, by the way. And come back soon.
Would love to. And great to meet y'all. Thanks.
I want to bring Joel in just to respond to the idea of, is like, how does science explain the research when even settling on the terms of research right now appears to be in so much dispute amongst many communities, if that makes sense?
It does. And to me, it's trying to get some of that ideology out. I mean, I don't think that we need to dispute how good science is done. I think everybody knows that. I think there's a lot of money and financial interests and personal interests that are involved in a lot of this research. Vaccine research is like nothing else. There are so many emotions that go into the word vaccine. As soon as that word is said, everybody seems to lose their mind. We have to take some of that passion away from some of that research. And I do think it's possible. I do think it's possible you can actually get gold standard research where the individuals who are involved, you can have different teams, you have different people from different backgrounds come together, follow kids, look at kids, use large databases. There are many ways that we could look into this and not just necessarily have every pro-vaccine person find a pro-vaccine answer and an anti-vaccine person find an anti-vaccine actor. And anytime anything about a vaccine comes up that seems concerning, then that study must have issues, that author must have issues. We have to debunk it. We have to get that person to lose their job. I mean, I don't want to get too deep down the rabbit hole with this, but there are plenty of concerns around the vaccine research and some of the studies. But at the same time, something like the Henry Ford study, I would love to see, instead of that leading to so much anger, I would love to see that get peer reviewed, have that discussion, repeat it in other places, and see what is found. And I think if we did that, we would get to a better place. But instead, anytime anything comes up that seems to have a concern, there's just arguing that goes on. We see headlines and we don't actually move the conversation forward. And then the individuals who have concerns around vaccines get even more frustrated. And I don't know, this is not very productive to me.
Nancy, I want to just bring us to this other part of the executive order, and it's something that Joel wrote about today in his Substack, which is the order instructs the Department of Justice, the Department of Education, to really interrogate whether they have levers to look at states that do not have religious exemptions for families that want to opt out of the vaccine requirements when they send their kids to school. Where are you on vaccine requirements for schools? Do you find that an affront? Like, these are bad? You can't mandate that a parent has to have their kid vaccinated in order to attend a public school? Or do you think the system sort of works where there's enough exemptions? Obviously, every state has a medical exemption, but there's enough, there's enough room there for families to exempt them, get an exemption out of the system if they want it? Or were you thrilled to see that the Department of Justice, for example, may be looking into whether it can go after states and bring like a legal case against states for not offering a religious exemption? Where did you come down on that?
I have my own bias in that, Tom, because after Steve's disorder played out and my concern about vaccines, I felt it could have impacted. I'm not saying the sole cause. I know genetic predisposition. I know all of that, but could it have been an environmental thing that really affected him? So going into school, we homeschooled for 7 years. And when it was time to go into school, they immediately said, the nurse said there, wow, he's way behind on his schedule. And I said, well, we're not going to do that. And she said, well, you have to do it. And I said, well, maybe I don't have to do it. And maybe he won't come back to the school system. So for me, in our particular situation, I didn't want my son to have any more vaccines. So I did play the religious, exemption card, and Steve went into the school system. So I have empathy for families that have the same concerns about their particular situation as I did, not having some form of an exemption. And I've heard of families moving states and feeling that compelled and that concerned about being forced to vaccinate that they've literally left the state. So, I hate to speak for all people, Tom. I can just speak for myself that it was a card that I felt I needed to play for our family to be safe.
We heard this. Thank you for that, Nancy. We've heard that a lot, which is, you can whip out that stat saying there's exemptions, but in reality, it's very hard for a family to get an exemption. Much like it's the same conversation we're here saying, pediatricians will blackball you if you don't say yes to the vaccines. They'll boot you out of the office, and no one really talks about that, but that's the reality. But Joel, talk about what you wrote about today about this sort of disconnect between what's actually in this executive order and a little bit of the celebration that's going on right now online that finally someone is, really taking it to it for religious exemptions, for example, for these vaccine requirements.
I mean, my personal bias is around medical freedom, and I do believe that people should have the right to choose. I'm all for vaccines. Again, we give them in our office. I try to educate. I have lots of families that come into the office that are fairly hesitant at first and end up doing it after having those discussions. And that is a big topic of concern and conversation. Just like Nancy said, the executive order does address it to some degree. I think there's a big disconnect online with people posting about how religious exemptions are back, personal choice is back, this is wonderful. And that's not really what the executive order says at all. It really just states that the Attorney General and the government can start to, or should, look into this a little bit more, should push a little bit farther, but it says, within the rules of the federal government. And so we're not even sure what that means, because most states, let's say California and New York, the ones that do have more strict vaccine rules, have already looked at the federal regulations and have decided that they are okay with not having religious exemption or personal belief exemption. So it really doesn't give any sort of rights and freedoms back, but it does at least acknowledge that it's a concern. And so I would say there is some potential that it could lead somewhere in the future or be helpful in some of the court cases that are ongoing. But ultimately, it doesn't change the rules at all.
And on that, I know we're about to wrap up. I'll just say, just from the perspective of a mom who lives in New York City, this is another one of those things, Joel and Nancy in particular, that I do think that we need to really dig into as a society, because I think from the medical freedom perspective, it feels like such a denial of liberty to have to take a vaccine in order to go to a public school. For me, I can also understand the feeling of discomfort knowing that there's unvaccinated children in a school where that could potentially affect other kids who, for instance, can't get vaccinated because they have immune compromised situations, and that they have a liberty too in that situation. They have a right not to get a disease, right? And so in some ways, it's like the right to public education is what's forced the conversation into what we want to put into our bodies. And I don't know quite where, like, in my head I am on that, but I would also ask to think about the idea of medical freedom also for that person who wants to be protected from disease, also views that as a freedom in some ways that they want protected. You know what I'm saying? Um, Craig, I want to give you the last word. What are some of your thoughts? And also, not to put you on the spot here, you wrote that piece in the Atlantic, Public Health Needs
Mhm.
MAHA. Do you still stand by that? What have the last sort of 24 hours kind of shown you, and where's your head at right now?
What's the last 24 hours? We've seen kind of this whipsaw. We've seen the reactions, including myself. I went on, social media. I went on CNN last night and expressed my profound anger with what happened in the Oval Office. I think there is an opportunity. There should be an opportunity. I wrote in that piece, there's opportunity and entropy. We need to take this moment, for all warts and all, and think about what the future looks like for public health. Yesterday made me angry, right? Like nothing, I don't think anything good came out of that. If in 2020 you were, part of the folks that were saying we need a state by state approach to COVID, but then yesterday you were cheering because you don't want to allow states to put their own requirements in place for school and you want the executive order to do it. Like there's so much inconsistencies over the past few years. And I feel like this doesn't play out well. I feel like I've seen over the past few weeks again, how the politicization of public health has just ramped up to an extreme that is not good for the public. One of the things that I have been thinking a lot about, particularly in light of what's been going on with Anthony Fauci, if you looked in the last 24 hours online, there's, all of this new stuff about Fauci knew about miscarriages during pregnancy and didn't say anything. So like doesn't cover actually any of the issues. He didn't like know it was a text message. And it turns out the actual studies show that there's not an increased risk of miscarriage. And so you just see so much at this moment. I don't know whether it's, an election coming closer, what it is, but just like politics just seeping so far in and it's creating a polarization in the public health community. And by that, I mean the broad community, whether you're MAHA, public health, whatever it is. And the reality is that if we treat this like an internet debate, where we have to win and we have to have our sides, we're going to be talking to ever smaller circles. The anti-vax community, despite how prominent it is online, despite how many followers Children's Health Defense has, does not speak for the majority of the MAHA community or the public health community or the American public. And similarly, and this is a lot of the criticism that I've had for my own, which is like we need to be able to listen to uncomfortable truths. I want more of my friends and colleagues to sit down with people like Nancy and to say, yeah, that's tough. And I understand that that must be really confusing and you need more from us. So when I say, and I wrote in that piece, Public Health Needs MAHA, what I'm saying is that like we are at this point where we are cleaving into two smaller and smaller sides and circles. And the reality is that what people want is they want something in between. They want to be able to ask questions, to have respectful disagreement, to find paths forward. That is what people want. But what you see online, what you see on dunking posts on Twitter, whatever it may be, is not reflective of that at all. And I don't think that this represents a good path forward for MAHA. Absolutely not. I don't think this represents a good path forward for public health. I don't think this represents a good path forward for any of us. Instead of us kind of pulling Fauci through the mud or whatever in the hell we're doing with the politicization and executive orders around vaccines, Like, we need to find a way that is durable, that is respectful, that allows us to move forward in the coming years, to say, I understand your frustrations, find a way to absorb those, to engage with those, and create a field that truly reflects and understands the reality of public health in this country right now. And if we just get into our sides more and more, or we think we can just get back in power and flip a switch, whether we're on the MAHA side, the public health side, or whatever else emerges in the coming years around distrust, none of us are going to be okay. None of us are going to be safe, and none of us will end up healthy.
Oh boy, that was very powerful, Craig. I just want to applaud you for saying that. I think I could see a lot of our heads moving. For those of you listening at home, there were heads moving. Nancy is hearting, is putting the heart emoji for what Craig said. And I'll just say, as a show who we have spent the last 18 months, engaging in conversations with people who feel very differently from each other. And sometimes those differences are so great that they really cannot be worked through. And sometimes the differences actually open the doors towards new agreements and new opportunities for collaboration. And, for us, we're going to keep doing that work. And yesterday, sometimes, like when something like that happens, it just reminds me of how divided we are. And I think that's why I too, Nancy, was a little sad, because it just like everybody kind of then has to quickly withdraw to their camps and say, like, are you pro or anti this executive order? And I think it sort of takes away from like the bigger mission that Craig just articulated so beautifully. It's just that we all want to survive and thrive. And how do we do that? I'm not here to suggest that government doesn't play a very important role in sort of either financing or shaping or enabling that. But at the end of the day, government works for us, and we get to decide how we want our lives to be, and we're going to keep doing that work. So I want to thank everyone for joining us here on Why Should I Trust You? Nancy Fuller, Craig Spencer, Joel Warsh, and Deb Houry. Thank you so much for joining us for this very special conversation.
Thank you.
And that was Why Should I Trust You this week. I am Brenda Adhikari. He's Tom Johnson. She's Maggie Bartlett. And Dr. Mark will be back with us very soon. Please send us questions and comments to questions@whyshoulditrustyou.net. Rate, like, subscribe, download, paint a picture, like bake a cake, whatever you want. And join us right back here next week.